The blame game over the scooter scandal continues. Eastern Cape Health MEC Sindiswa Gomba is blaming apartheid for the failed scooter project. She says weaknesses in the health system is linked to the design of apartheid infrastructure. Now, the 10 million rand project was to transport patients from rural areas to hospitals and clinics. Well, Health Minister Dr. Zweli Mkhize confirmed that the scooters do not meet the basic criteria. Let's speak now to the Parliamentary Health Portfolio Committee Chairperson, Dr. Sibongiseni Dhlomo. Dr. Dhlomo, thank you very much for your time. I've got to get your thoughts on Sindiswa Gomba blaming apartheid 26 years into democracy for basically the province's worst, I guess, transaction, if you like.
Yeah. Good morning, Oli. Good morning to ENCA viewers. Unfortunately, we could talk about the scooters in the Eastern Cape as I am currently engaging with the chairperson of the Portfolio Committee, Honorable Dimaza. But you would really respect that I can't be a political analyst giving my interpretation of a politician's speech as to what is my thinking thereon. So what she said there, I'm not able to assist you to analyze, but I can give you what are we doing regarding the challenges that we notice in the Eastern Cape.
But Dr. Dhlomo, you have got to surely reprimand your fellow comrade, if you must. You are an ANC member. She's an ANC member. Frankly, do you think she's competent?
Look, Oli, let us not go there, because if I could actually indicate to you, up to last night, I was in a telephonic discussion with Honorable Masa. We are planning to have a joint meeting, both portfolio committees of the province and that of the National Assembly, because we would like to have an understanding. We do not want to think that we understand better than Honorable Dimasa the challenges of the Eastern Cape. We were there 2 months ago. There are certain things that we said should be done, and some of those things have not been done. And we want to understand from them, the closest parliamentarians, what are the issues that are actually preventing those things being done, like the field hospitals in Butterworth, the field hospitals in and around Umtata, the hiring of the Chief Director Infrastructure. Now, let me just say, let's complete those discussions with the Honorable Chairperson of the Portfolio Committee before we can go public. Because from the National Assembly, we do not want to think we know better than them. So we are engaging with them and we want to have an understanding. For you to really request me to interpret and do a political analysis of another politician's speech, no, that part I won't be able to do.
All right, but you were prepared just a few weeks ago to stand up and make a political speech, in fact, respond to a political speech from the opposition benches that the Eastern Cape must be placed under administration for its worst performance in handling this pandemic. Do you still maintain that? Why is it that when it suits you, you are happy to speak politically?
I'm not going to actually dispute what I said there. I still say it now. What I am saying, Paul, is that there is a process for us to understand every part that we have really requested about Eastern Cape. That politician was saying there should be an administration in Eastern Cape. I'm saying part of what we observe in the Eastern Cape as challenges are things that were transported from the Western Cape that I cannot change. It's still true that there were deaths, there were certain things that were not handled well in the Western Cape. Those things had an impact in the Eastern Cape. Hence, you are saying the failure of the Eastern Cape cannot be singled out of the challenges and failures that have taken place in the Western Cape. That part I still stand for.
Dr. Dhlomo, then let's perhaps wrap up our discussion by you giving us your assessment as chair of the Health Portfolio Committee, just specifically on the Eastern Cape situation, the hospitals there, pictures that have come out of that province in public health institutions, they frankly frightening, and no human being should be subjected to that kind of treatment when they go to a facility to seek medical help. The field hospitals you talk about that have been erected in the Eastern Cape, those have been done with the assistance of the private sector, in fact solely by the private sector. So at which point does the government of the Eastern Cape show itself to be competent? Why shouldn't they be put under administration?
I could only be able to briefly complete that response to you only after our Wednesday meeting. As I have indicated to you, those pictures are really alarming. Hence, we have started the process of engaging with the chairperson to say, Portfolio Committee in the province, we were with you 2 months ago. These are the things that were agreed upon. Where are we in terms of those things? Why are they not happening? What is our response thereon? So we will have a collective response only once we have completed that process. We have not really left those things unattended to. All I'm saying is that we are doing this jointly, and therefore our response will be joint. We need to give response and respect to the leadership of this government that is closer, and of the legislature that is closer to us, to the process in the Eastern Cape. After that, we will be ready to engage with you and give you proper and complete responses.
Dr. Sibongiseni Dlomo, thank you very much.